Rasheed, I think the work that you do in your lab is truly impactful in the translational space. You do basic science, but it's basic science with the lens towards improving the care of patients. Can you tell us a little bit about your incredible research program?
Thank you so much, Svati, for that question. So I will just start by saying that our research focuses on using genomics and other omics tools to understand the pathogenesis of nephrotic syndrome and other glomerular diseases. We focus especially on a morphologic type of nephrotic syndrome called focal and segmental glomerulosclerosis. If you talk to nephrologists practicing in the US, they will let you know that FSGS, that's the abbreviation for focal segmental glomerulosclerosis, disproportionately affects people of African ancestry, and it is a leading cause of end-stage kidney failure in the USA. So using our genomics and multiomics approach, we and our collaborators have identified at least 10 genetic causes and genetic risk factors for nephrotic syndrome in the last 15 years. Most of these loci and genes are currently the subjects of studies to identify novel pathways that may lead to new therapeutic targets. And this is actually what is exciting about it. You are starting from the patient, you're collecting the sample, taking the sample to the lab, you interrogate the sample, you identify genetic causes, and then once you identify the genetic causes, you then say, okay, how does this cause disease? And that's actually what leads to a new therapy. And I will illustrate that by actually paying tribute to my late mentor, Dr. Michelle Nguyen, who started this program many years ago. Dr. Nguyen identified mutations in TRPC6 as a cause of autosomal dominant FSGS more than 15 years ago. It is interesting to note that compounds targeting TRPC6 are now in phase 2 and 3 clinical trials for the treatment of both familial and the more common idiopathic FSGS. If you talk to people in the biopharmaceutical industry, they will tell you that this is actually a phenomenon turnaround, between discovery and then talking about clinical trials. So that's actually less than 20 to 25 years. In talking to people in the industry, it takes a lot longer than that. So to Michelle Nguyen, talk about lasting and enduring legacy.